Hi, and welcome to the Fabulous Cancer Podcast. Today I'll be talking to Tammy, and we're going to talk about being a cancer survivor, and we're also going to talk about doing fitness before, during, and after cancer treatment. So, thank you so much for joining the podcast. Really happy you're here.
Thank you.
Would you like to introduce yourself, who you are, and where you're from?
Sure. My name is Tammy Salamone, and I am from Orange County, California. And I guess the next thing you want to know is I was diagnosed with breast cancer in early of 2017.
Okay, yes, that was my next question, so I'm glad you answered it. And I read on your blog that you lived a really healthy lifestyle before you got sick. And this might sound like really personal, but what did you think when they told you that you had cancer, even though you did so much to prevent it?
Yeah, I was really completely thrown off. I was so shocked that I did ask my doctor, the oncologist, and the breast surgeon. I said, you say to work out, get sleep, don't drink or smoke, eat healthy foods. I was doing all of those things, and more. And then I still got cancer. So I was, pretty devastated. Like, if this could happen to me, then, it could happen to anybody. And being a personal trainer, at first I was embarrassed. Like, I didn't even want to tell my clients that this had happened, because here I am, showing them like this is a healthy lifestyle and this is what you should be doing. But then I got breast cancer. So you do a lot of things that you can prevent it, and hopefully, you won't get it. But then there's certain times where it's just completely out of your control, and it's just something that happened and you have to deal with it. And I do feel that because I had the healthy lifestyle, the base, before I got diagnosed, it completely changed my whole, path going through it and after. And as far as, recovering very quickly from chemo treatments, recovering very quickly from surgeries, and then just, having enough energy to kind of, go throughout the day, I feel that if I didn't have that, especially the exercise background, then I feel like it would have been completely different for me and much, much harder to get through.
Yeah, exactly. Wow. And that's actually really like for me sad to hear like that you didn't want to tell your clients, because it's like cancer is so it almost doesn't matter what you do, like what you've been through. If you do everything to prevent it and to do that, and then something like that happens to you,
Yeah.
that's really sad. Yeah.
It
um
was, like I said, I felt embarrassed, and then I was just sad, just going through all these things. And then I was like, well, I have to just show them that I'm going to come out of this and I'm going to be, just as strong as I was before.
yeah, definitely. um what kind of treatments did you have?
So, like, things were kind of like mixed up for me. Originally, I just, had a routine mammogram. They had found a suspicious spot. Then they did a biopsy and, MRIs and all kinds of things. And they ended up finding like one spot and one that was kind of suspicious. So they told me that I could do a mastectomy or lumpectomy with radiation. So I chose to do the mastectomy just because I wanted to kind of be done, and because they were testing me, for those 2 weeks, like all the time, calling me in and doing another biopsy and different MRIs. And I was just, oh, I can't live my whole life like that.
Yeah.
So I decided to do the mastectomy. And then 2 weeks after, when you get your pathology report, it found a second bigger tumor that was so far back on the chest wall that it had been never seen by all those tests. It would have been missed, she said, for years, because it was so far back on my chest wall. So then it's called HER2 positive, and it's just a more aggressive type of breast cancer. So I was supposed to be done after my mastectomy and have my reconstruction. But then she calls and she tells me, now you'll need 12 weeks of chemo and a year of every 3 weeks, I would get this specialized, drug called Herceptin that would be for HER2 positive breast cancers, which is also through an IV. So for a year, I had to have treatment, and I couldn't believe what she was saying. That's when I was really, really devastated.
Yeah.
So
Wow.
that was kind of crazy for me. And I think at that point I had like a vacation planned or something. So I said, let the family just go on vacation. And then as soon as I get back, I'll start. And she did allow that, my oncologist. And then I came back and started my 12 weeks of chemo. So it was once a week for 12 weeks.
Mm.
And then every 3 weeks for a year, I just kept going back to the chemo place. And it's such a long year. It's exhausting. Luckily, there's a few side effects that you can get from the second treatment, but overall, I think I was just mentally and physically exhausted,
Yeah.
and I thought that year was never going to end,
No. No. Oh
but
my
it
God.
did.
Yes. Thank God. Yeah. Yeah, I had the same. There were times it was like, oh my God. Because I had also treatment, I think, for like 1.5 years or a year. I'm not sure. Oh my God. And there were just times it was like, it took so long. I think like mostly the effects from chemo make it so bad, like make everything so much worse to wait and everything. Wow, that's crazy. So if you didn't had the surgery, they wouldn't have found that?
Yeah, she said that if I didn't do the mastectomy, then she said, I don't know when, we would have seen this. It probably would have been at that point, she said, like stage 3 or stage 4, because it would have been so big,
Yeah.
to be able to be identified. So that was really a blessing because we went back and forth. Me and my husband were like, should I do lumpectomy? Should I do mastectomy? We didn't know. And then we felt really good with our decision. And hopefully that, God was kind of directing me that way because of that.
Yeah, exactly. Wow. Well, that's really good then because, wow, yeah. But it's so strange, like sometimes when they say they couldn't have found it before, because I had a misdiagnose of not having cancer, um, and and because I broke my hip, and I was sitting in a bed for 6 weeks because they thought the blood would come together and then bone would develop, which it didn't. And then they
Oh,
did, even though they did like an X-ray picture, then they still, didn't find it because previously they did a biopsy, but they didn't find anything because they didn't actually hit the cancer cells. And later they
right.
were like, okay, well, we need to do surgery because the bone doesn't heal, and that's only when they found the cancer cells. So it's kind of weird how sometimes you can't really see it on the X-ray, but I think it has to do with the colors or something.
Yeah, and for me, I later found out that my breasts were extremely dense, and then that makes it very, very difficult for them to see anything. So
Oh,
that's making more sense because as they are like looking, and even like a mammogram, they kind of, they kind of squish the tissue together. Well, is making it even harder for them to see, I guess, what was back there. So
yeah.
that's why I think it was missed.
Ah, right. Wow. Yeah, well, yeah. Well, I'm glad everything like went so well eventually for you. That's really good.
Thank you.
So what has helped you through the treatment?
I would say, there were times where I was very down, especially, coming from thinking I was being done and all of a sudden having this year. I had moments where I was just so down and so depressed and so sad that I thought, I'm never going to make it through. But I kept working out, and I would, no matter what, even on my chemo days or my day where I felt just so nauseous, I would make myself get up and just walk for an hour on the treadmill or outside or whatever I could do. That was like my minimum. And then throughout the whole thing, I kept just trying to do some weights, just a little bit. I'd go to the gym sometimes, but when I lost my hair, then I wasn't as comfortable going to the gym. And I didn't want to get sick because, you never know
Yeah.
what's there at the gym. But I would still do things at home, and I just kept trying. And I was really strong before my surgeries and chemo, but I had to take it all the way back. I would just go with really light weights, and then I would just worked my way back up and just kept trying to move. And I really saw such a difference where I would see the other women who were just so sweet in my chemo, and we would talk, but they had a lot of different problems like lymphedema, and their bones, would ache, and they were very, very tired. But I had more energy for sure,
Hmm.
and I was recovering very quickly from the treatments and the surgery. I saw my plastic surgeon one time, and it had been 4 weeks, and he's like, so what's it been, like 9, 10 weeks now? And I was like, no, it's only been 4. So he was like, wow, you're healing, so quickly. And I do think that the exercise has something to do with that as well.
Yeah, definitely. Definitely, because that's what I see in my hospital now as well, is that they're telling the children to actually be as active as possible and, run around and do like biking on little bicycles and
Right.
stuff. And because it actually makes the body heal, I think, faster and stuff. So I think
Right. I
it's.
remember my oncologist too, like I would go in for chemo and stuff, and then she would say like, well, what did you do today? I was like, oh, I ran a mile, and then I walked, and then she goes, well, just keep doing whatever you're doing.
Wow, that's amazing. Yeah, because um what did you what really motivated you to like to keep doing like
Oh,
fitness, yeah.
working. Yeah, that's a great question. I didn't even think about that, but actually it was, I had heard that breast cancer patients, they will often gain weight from the treatments.
Mhm.
And I was like, I've worked so hard. The last thing I need, I'm going to lose my hair. I can't gain weight too. And I didn't want to lose all my fitness, base that I had to my strength. So I think motivating me was I wanted to keep going. I wanted to definitely not gain weight. And I also wanted to show, like I said, my clients or whoever, people, now that I've met, that look at, you can come out and be really strong and recover. And it was June of 2018. So, 18 months ago, really, that I finished everything. And people have no idea. They will look at me today and can't believe what I went through.
Yeah, because you look really sporty and really active and really like motivational and inspiring, well, in my opinion, to be
Thank
like,
you.
yeah, you're welcome, to be like, yeah, let's do this and let's go, and like even your pictures are like, yeah, I want to do fitness, even though I'm not sick anymore, I'm like, where do I start with doing home exercises? I'm too lazy, I mean, I do sports once a week on a Thursday evening, and I really want to do stuff at home, but sometimes I'm just too lazy, and especially when I was sick, I was just too tired. Like I had a physical therapist, and she was like, yeah, let's learn how to walk and stuff, and I'm like, no. And then sometimes I saw that she was walking under the department, and and I just pretended to sleep. And my mom was like, no, no, she's sleeping now, So, but now I hear all of this, and I'm like, yeah, well, I should have actually done a lot more, and even now do a lot more because it really helps a lot. So, yeah, definitely.
Does. And I've been reading so many studies too, big studies from big cancer hospitals that if you exercise just moderately, it's not a lot. They're talking like 20 or 30 minutes a day of just moderate walking, and it can reduce your reoccurrence rate by 40 to 50%. Especially for breast cancer, that's what I've been reading. I imagine it would be, across the board for all cancers. And that's not really a big deal, 20, 30 minutes walking. And if you can reduce your reoccurrence rate by that much, I feel like that's what I'm trying to get out there to everybody. Like, look at that. You don't need to take a pill. It's free. It's so easy to do. Why wouldn't you not do that?
Yeah, absolutely. And I actually agree with that because it's also like if you feel so tired and sick from chemo and feel like, oh, I'm like, you already think if you wake up you're gonna sleep for the rest of the day or you're gonna lay in bed for the rest of the day, you can probably make it your goal to just get out of bed and just walk for 30 minutes or for 20 minutes or do even
Right.
some arm exercises. Like, I couldn't stand on my legs yet, so they gave me like weights for my arms and stuff, so even that helped a lot. So yeah, I
True.
think that would also really be good, like motivational or like a to-do thing for your day if you're dealing with absolute worst fatigue and everything during chemo.
Right. And it does, you think I'm so tired, how can I do it? But then it does actually, when you're done, you actually have more energy and you have to listen to your body. If, you are going through chemo, I did have, the one day after where I still would walk, but after that, I just would lay on the couch, and I was kind of nauseous and there was nothing I could do. And that's okay. You have to listen to your body. But especially when you're done, then, there's no reason why you can't just start, even if it's 10 minutes, do whatever, you can do.
Yeah. Oh wow, that's amazing. So how did you start with fitness?
Well, I loved working out quite a few years ago. I was going to this little gym and I just loved it. And then my children, they were growing up, and I thought, oh, I don't want to go back to like a desk job, but I do love working out. So I became a personal trainer. I think it was about 14 years ago now, and I just loved it. And I've taught in a small gym before, and now I just go to people's homes and I do personal training there for them, and I'm trying to, kind of focus more on cancer patients and during my treatment because, you're just kind of laying there sometimes and you feel like, what am I doing with my life, especially when it's, a year long. So I got like a special certifications for breast cancer patients. And then I recently became certified with the Cancer Exercise Training Institute to help different cancer patients with different problems that they may have. So I'm trying to kind of just branch out there, and I've started to make these YouTube videos that are between 5 minutes. Some are 15 minutes, but a lot of them are just 5 minutes because, like you said, you can't do a whole lot. And I even have one, and I'm going to make some more where it's just from a chair. You could do it all seated, so it's all just upper body. I'm just trying to kind of think about, the different populations and what I can help them with. And they're just free. And I just really want to, help people is like my main thing because you go through such a awful, terrible experience, but then something good has to come out of it. And then I hope this can be it.
Yeah, definitely. And yeah, and I've seen your YouTube videos and I'm like, oh, yeah, I want to work out, which I never have. You know, but especially because they're so like short, it's not like, okay, we're gonna do fitness and the video is like 50 minutes long and I'm like, where do I start?
Yeah, an hour, I know.
Yeah. So what you're doing is really amazing. And I actually, I don't know if this is kind of weird question, but do you have a book about this stuff?
Oh, I don't have a book about that, but it's funny you asked because I'm just currently trying to like write something. I don't know if it's going to be like tips, of how, because I have so many women who ask me, what did you do during this? Or, what can I help to have this problem? Or, so I thought I should write this all down in one place, so that I don't forget, because you start to forget things and I want to be able to have that to help. So I'm currently trying to write something.
I'm just saying this because I think you like, not to tell you how to live your life, but you should really write a book about this, because
Thank you.
yeah, I mean seriously, because you can sit here and write a book and have like, okay, if you're dealing with super fatigue, you can do like 5 minutes exercises, and this is the improvements, this is the effects, this can, like I've dealt with this myself and stuff like that, and I think that would really help so many people, especially because you want to reach out to so many people, and they
Right.
can just like, I think that would be absolutely incredible, and you're just like the perfect person for that, honestly. You know, when I saw your website, I'm like, so professional and beautiful, you know. So you should
Well,
totally do
that's
that.
so sweet. That's really nice. Like that really encourages me because sometimes I'm like, what do I know, about writing a book, but where do I start? But thank you. That's so nice of you.
Yeah, yeah, thank you. But you should do that. Like it would be so helpful for so many people, and the good thing is that you've been through it. So you are also the type of person to say like, you know, you can do 5 minute exercise, 5 minutes, or like 10 minutes, or like 15 minutes, or like what would it, you know, what's different if you do 30 minutes and then like every, I don't know, hour, 5 minutes or something, and then eventually get to 30 minutes for the day. You know, I don't know, something like that.
Right.
I'm not a sporty person necessarily, but I had a lot of physical therapy, so I kind of get the, you know, the point when I had a physical therapist and they were like, oh, you need to do like an hour of exercise, and you can cut it into like 30 minutes in like a day or something, you know, like in the morning half an hour, and then in the evening half an hour. So I don't know, I'm just throwing
Yeah.
something out there to you should really do that, because that's really gonna help a lot of people, and I'm sure I mean, I already know that you're gonna be amazing at that, so I would totally recommend you doing that.
Thank you. That is really encouraging. Like now you motivated me to keep going, just keep
Yeah.
writing whatever I can write about and just get it together. Like I would love to be able to do that this year.
Yes, you and you can do that. You know, you would be amazing at it. So just keep doing that, and it's gonna be amazing. Okay, so this is
Thank
completely off topic, by the way.
you.
Yeah, yeah, just keep doing. You can do this. And I'm already thinking about like you have like a pink cover or something. I don't know, something nice and cute and like with your dog. I don't know. I'm just excited. I'm thinking way too much about this. So I have a question. What do you think? Is there much of a difference between if you don't do exercises before cancer treatment, during, and actually if you do? If that makes sense.
Yeah, I feel that, if you do start exercising now, for everybody out there who doesn't have any problems, they don't have cancer or anything like that, because you don't know what disease, or I think I was just reading something where half the people, 50% of people will be diagnosed with some kind of cancer in their lifetime. Well, that's a lot of people. So if you start doing something now, when you do get a diagnosis like that, you're going to feel so much stronger and capably mentally and physically to be able to, I'm ready to take on chemo or surgery, whatever you need, because it's not easy. So if your body's already broken down and then you get that diagnosis, you're going to have a really hard time. And sure, you can still get through it, but it's just, why make it harder on yourself? And I feel that, I had talked about how it did make the difference in my recovery from everything. So if you do it before, that's great. During, I think mentally and physically, it really is quite a help because, why wouldn't you feel depressed? I mean, you are losing so much, and sometimes you lose body parts and then your hair and so many things that it can be very upsetting. But then you get that little lift from working out, and I think it helped save me, to get me through that. And then after, how I had mentioned the lowering your reoccurrence rate, and also it lowers your death rate, of dying from that cancer that you had. So it's just so many great benefits to working out.
Yeah, yeah, and I completely agree with you, because even though, I mean, I was quite active before I was sick and then not when I got sick, but from all the studies and everything that they are doing right now, and where they actually scientifically prove as well that it is such an improvement and such a good thing, that like fitness, sporting, or I don't know, sport, really improves cancer patients, or before or after, even for surgery before, if they're not doing chemo, but they're like, okay, we're gonna do, I don't know, some sporty exercises, and then they have the surgery, they're most likely to recover faster as well, I think.
Right. Yeah. And, I think it's important for like everyone to know. I know everybody's different, and some chemos are going to be much, much harder, and that's okay. Just, you take the time that you need, but then as soon as you can, you just start and try and maybe find something that you love. Because if you just like, oh, I really hate this, or you don't have to do running or something, crazy. Just do something that you find some kind of enjoyment, and that way you'll stick with it, hopefully, for your whole life.
Yeah, and that's completely true because I had physical therapy for more than a decade. And at some point, I was like, I don't want to be calling it physiotherapy or like physical therapy. I don't want to go to this whole kind of medical, be stuck in that. And then later, I was like, oh, okay, I want to do Pilates. And then I found out that 90% of the physical therapy exercises I did was actually Pilates. And I'm like, wait, what? Yeah.
Right, right. Isn't
Be-
that funny?
yeah, because,
And I
yeah.
know a lot of people benefit from yoga. I mean, there's so many different things out there you can try.
Yeah, definitely, definitely. And now I was like, okay, I don't want to do Pilates anymore, so now I do fitness, and it's so incredible to see your body like how do you say, like getting sculpture?
Yeah, no, it does. It changed, it does. You see those changes and you start, feeling fitter and looking fitter, and, the muscles, and it's very empowering, and it does make you feel really good about yourself. And you do need that after what we went through.
Yeah, definitely, and especially if you don't want to call it like I said, with the physical therapy or something, but like, oh, I'm kind of done with it. Try to find something that is actually probably has the same exercises, but it's called something that you kind of feel more like you're a normal person and not a patient or sick or kind of life after cancer. More like, okay, I'm gonna do Pilates, same exercises, gonna do fitness or yoga or something. That helps a lot as well to become more, feel more like not like a patient or like you're feeling stuck in a medical world or something like that.
Exactly. And there's some good classes out there too, that you can find. Or if you just prefer, to work out at home, there's so many different videos now, besides, the ones I'm doing. There's so many free videos out there, and they range in time, from an hour, or you could do something that's only 20 minutes. So that's good too. If, they're not comfortable being around a big crowd, then at least they're doing something.
Yeah, absolutely. Absolutely. So my other question is, what made you decide? Yeah, what made you decide to help cancer patients and survivors with fitness? Well, I mean, you said you were already a personal trainer before.
Right. So I already, had that background, but then going through it all, I did have, some extra time. So I would study, and I did this program called the Pink Ribbon Program. And that is to help breast cancer women recover from their treatments and surgery. It's like a post surgical exercise kind of program. And then later, it was at the end of last year that I actually became certified with the Cancer Exercise Specialists Institute, just because, you're going through it and you think like, I have to find something that I can give back, or how can I help others now? And I was so uncomfortable, especially when I lost my hair, that now I feel if someone wants to work out and they lost their hair, it doesn't matter. I don't care. Like, I understand, I could help them. They can feel completely comfortable with me because I lost my eyebrows and my eyelashes, and just, I was feeling like, oh, I don't look anything like myself. How can I go, to the gym? It's going to be just too embarrassing to see all these people. So I hope that, they can feel completely comfortable with me. And that's why I think I keep trying to reach out to different cancer patients so that I can help them and they don't have to be embarrassed about anything.
Yeah, and that's really amazing. I think as well because you're really an inspiration, and as well when people look up to you and they have questions like, okay, well, I don't want to do exercises, but I feel like I need to, then you can give the advice of like, okay, well, this is the positives, and this is the good stuff that comes out if you actually do fitness or sporty stuff during chemo or cancer treatment. and they can see that, and you can tell your story and inspire others during that, which is really amazing, I think.
Thank you. Thank you. I needed it. I knew I needed it for myself. And I know I had my reasons for why I kept working out, but I think that, it could work for anybody, whoever wants, if they haven't worked out before, they can start out very slowly with stretching. And because with the surgeries too, you lose a lot of your mobility and you have to kind of get that range of motion back. So there's like all levels, I think, can benefit, from something, some kind of exercise.
Yeah, definitely. Oh, amazing. So what do you do in order to help others who have survived cancer with fitness? Like, do you give classes or just advice, like on your blog, or do you give courses?
Well, right now, people like reach out to me through social media pretty much, and I'm happy to answer, any of their questions. And then I've put out the videos on YouTube to kind of, hopefully help kind of inspire them and give them some idea of what they can be doing. But right now, yeah, I've thought about possibly doing like a class or something. But I'm not sure, like, if I'll do that maybe through like one of the hospitals, but I haven't done anything like that yet. And then I am currently working on, writing a book of some kind too. So hopefully that would be helpful. So yeah, I'm not 100% sure where, my direction is going, but I know that I want to be able to help people. And of course, locally, but that doesn't help too many people. I am available, to train them, but I'm in Southern California, so I know that's kind of limited, of who I could reach that way. That's why I feel like if I could do it on social media or through YouTube or something, I can reach so many more people.
Yeah, definitely, definitely. And keep the book going, because that's going to be absolutely incredible, I think, to help so many people. It's going to be amazing.
Thank you.
So where can people reach out to you or get in contact with you?
I'm like very active on Instagram, and it's my name, so it's at Tammy Salamone. And I think it says like at Tammy Salamone, the Pink Survivor. And then also through my website, which is thepinksurvivor.com. And then on YouTube, if you also type in my name, Tammy Salamone, I think it comes up also Pink Survivor. So those ways I'm sure, Facebook as well. It will also say the Pink Survivor or my name. You can find me as well.
Oh, awesome. Okay, I'll put all your links in the description as well, so people can find it through there.
Great.
Awesome. Well, thank you so much for joining the podcast and telling your story and sharing all your knowledge and your experience. It's really nice to learn from you.
Thank you so much. I hope that I could just motivate one person to go out there and just start moving and just doing something today.
Yes, I'm sure you will. And if at least you moved me already, so it's really nice. Well, thank you so much. Well, I'll see you guys in the next podcast. So thank you so much, and have a nice day.
Thank you.
If you want to listen to more podcast episodes or want to get in touch or join the podcast, go to instagram.com/thefabulouscancerpodcast. Thank you so much for listening, and I'll see you in the next podcast.